One doctor says you need surgery, another says you don't. So, what should you do? First, don't panic because this situation is more common than you think, especially with spine conditions like disc diseases, wherein different doctors may give different advice as your condition may not be an emergency. And in many cases, there is more than one correct way to treat this. The key is to understand your own condition clearly before making a decision. Start by looking at your symptoms. If your pain is disabling, or is it mild or manageable? Are you able to carry out your daily activities, or is your quality of life significantly affected? More importantly, check for red flag signs such as progressive muscle weakness in the legs, difficulty in walking, or loss of bowel or bladder count. Because these situations may require surgery more urgently. If these warning signs are not present and your symptoms are stable or improving, then conservative enough management including physiotherapy, staying active and giving some time can be very effective. Another important step to consider is why each doctor is recommending their option. Ask simple but direct questions. Why surgery? Why not? What happens if I wait? What are the risks and the benefits of each approach? When you understand the reasoning, the confusion becomes much clearer. If you are still feeling unsure, do not hesitate to get a third opinion from a specialist. And it is completely reasonable because this is your body and this is often helpful. Remember, most non-emergency spine conditions allow you time to think and decide carefully. You do not have to rush into any kind of a surgical input because of fear. Focus on your symptoms, understand your options, and make an informed decision that feels right for your body. If this video has helped you, like this video, subscribe to my channel, and share it with someone who are facing a similar situation. See you in my next video. Bye-bye.